63 ayes and 34 noes, Senate Bill 70 is concurred in.
The Republican-controlled Senate passed a 2-year spending plan, which will now head to Governor Tony Evers' desk, where a veto is expected for some of the plan. There will be cuts across all income levels. The University of Wisconsin is also getting nearly $500 million less than what it asked for, which university officials say will have major impacts on UW campuses across the state. Democrats say this bill fails to invest in things like child care centers and post-secondary education. Representative Lisa Subeck says, quote, Wisconsin is one of just 10 states still refusing Medicaid expansion, and that means taxpayer dollars paid to the federal government by hardworking Wisconsinites are going to fund health care in other states.
Republicans say the $3.5 billion tax cut will lower the rates for all taxpayers across the state and will go from 4 brackets down to 3. They also say taxes were cut by $4 billion, and they will put $1.5 million into our roads and $1 billion will be invested in schools. Speaker Robin Vos said, quote, I am proud to join my Republican colleagues by voting in favor of generational investments to benefit Wisconsin children, businesses, and taxpayers. Legislative Republicans work tirelessly to provide a budget that truly invests in our core priorities as a state in a targeted and efficient manner. Now, with this, child care service providers are reacting to the possible loss of funding.
And many who have been benefiting from the Child Care Counts program created during the COVID-19 pandemic. NBC 15's Tyler Peters joins us now in the studio.
Yeah, Tyler, you spoke with a child care provider about how this might impact them.
Yeah, Maria, Mark, the Child Care Counts program's funds are set to last until January 2024, and monthly payments to providers have already declined by 50%. One child care provider tells me it's forcing her to raise her rates.
It just was really like a gut punch slap in the face, and it really motivated all of us to get together and start trying even harder to help them understand what it is.
Corrine Hendrickson runs a child care service in New Glarus. She says she and many other providers in Wisconsin rely on the Child Care Counts program.
We've been really talking about how this helps stabilize the industry and helps put some money in so that we don't have to rely on the parents' ability to pay.
The COVID-era program has allowed child care providers like Hendrickson to offer affordable rates to families.
No matter where you live, no matter what your income is or anything like that, we get the same amount per child, the same amount for operational, and the same amount for quality.
Hendrickson hasn't had to raise her rates since 2018. Now, as possible budget cuts loom, she says she has to.
I've been very open and transparent with my families. They have known about this the whole time. Because really, it's not just the parents that are paying, it's us that are paying too, because we can't charge enough to be able to pay ourselves a living wage, retirement, any other employer benefits that people normally get.
A survey from the National Association for the Education of Young Children says more than 27% of providers in the state will shut down if the program doesn't continue.
It just all comes down to our priorities, and you claim to want to support working families and you want people to work, but then you're taking the very tools away from them that they desperately need to be able to work. And at the end of the day, you're saying it doesn't matter.
Governor Evers did submit a request to the JFC today asking to use remaining federal funds for child care assistance. Hendrickson says that she and others are now reaching out to state legislators asking them to permanently fund the Child Care Counts program. In Madison, Tyler Peters, NBC 15 News.